Good afternoon all, I am Dr. Gowthami, consultant gynecologist in Milan Fertility and Birthing Center, Kumaropat branch. So today we are going to discuss about awareness of heavy periods. So from the menarche to menopause, in the reproductive age women, they will get menstrual cycles. Okay, so the normal characteristics of these cycles are they will have 24 to 38 days ka length, and in the beginning 2 to 8 days they will bleed, that is called menstruation, and the bleeding quantity will be around 5 to 80 ml. This is the normal characteristics. So when we can tag it as a heavy periods, so whenever the bleeding is going for more than 8 days and the bleeding that is soaking more than one pad within 1 hour, and these kind of hours are going in a row. Okay, so and bleeding that is happening in the nights which requires frequent changes. Bleeding will happen during the menstruation, but it is requiring the frequent changes and bleeding associated with the clots, and if woman needs more than one pad to control the menstrual flow. So if the bleeding is like this, definitely definitely we have to consider it as a heavy period. Okay, now these heavy periods are like a sign for underlying health problem which needs a treatment and management and treatment. Okay, so this menstrual period, so if we are not treating this heavy menstrual period, patient will lose more and more blood and she will land up in the anemia. So these anemia further will lead to the health problems and especially heart problems. So it is very important to identify this condition and seek medical attention and manage properly. What causes these kind of heavy periods? So there are so many causes which will cause this kind of HMB. Okay, so in this, see here, some causes are like polyp, that means extra growth from the endometrium. This is the endometrium lining of the uterus, extra growth from the endometrium. So polyps, and adenomyosis, that is growing of inner layer of this lining into the muscle layer of the uterus. Okay, this is adenomyosis. And one more most common cause is fibroids, that is benign tumors in the uterine cavity. Okay, along with this, other causes are like any medications, blood thinning medications like aspirin. If the woman is using these kind of medications for other health issues, that may lead to the HMB, and women using intrauterine devices for the contraceptive purpose. So these also will lead to the heavy menstrual bleeding, especially in the first year of the use. So other causes for this HMB are like irregular ovulation. See, suppose in the natural cycles, in every cycle, women will ovulate. So if at all ovulation was not happening, the uterine lining will become thick, and this will lead to the heavy menstrual bleeding. These kind of irregular ovulation can be occur during the puberty, that means at the starting of the first periods, and in the end of the when the woman approaching the menopause, that is perimenopausal period. Okay, so now we will go ahead with the evaluation of the heavy menstrual periods. When woman comes with these kind of complaints, first of all we will elicit the history, whether she have any medications that will lead to the bleeding, or if she has any bleeding disorders kind of history like bleeding gums and bleeding into the joints, etc. Any family history of the bleeding disorders, and if she has any copper in situ inside, or she is on any birth control pills like that, we have to evaluate. And then following the history, we will examine the patient both physically and pelvic examination. Physically to rule out the anemia and other health causes, and in pelvic examination we will see the condition of the cervix and vagina, if at all any infections are there, and any STD, signs of STDs are there, and how about the uterus size and all, is there any enlargement of the uterus, everything we will find out through the pelvic examination. Further, all these findings will be confirmed by the investigations like basic investigation. First we will do the CBC, that is complete blood count. How about the blood volume, everything we will know by the CBC, and coagulation profile, so that we can rule out any bleeding disorders are there like that. And further we will go ahead with the imaging tests like ultrasound scan to see the structural problems of the uterus. As we discussed earlier, is either any polyps are there, or if there any extra growth of the endometrium is there, or fibroids are there, adenomas, everything we can find out through the ultrasound imaging. If at all ultrasound is inconclusive, in some patient even MRI might be needed. Now, if we come for the management of these kind of women, first of all, we have to treat them symptomatically. That means to stop the bleeding or to decrease the bleeding, we will use tranexamic acid. And if these periods are associated with the pain, we will provide them with the NSAIDs like ibuprofen, mefenamic acid, etc. And the treatment part will goes according the cause of the HMB. Okay, if at all the cause is due to endometrial thickening or polyps, what we will do? Simply we will remove the polyps. Okay, and if at all it is due to the adenomyosis, so it will need the medicated devices to insert inside the medicated devices like Mirena is very good treatment for the adenomyosis. And if at all she is suffering from the fibroids, if the based on the number and severity of the condition, and if she wants to retain the fertility based on the situation, we will tailor the treatment for the patient. Okay, if at all she is desiring to retain the uterus, yeah, we will, and less fibroids are there, we will do the myomectomy, or we can go ahead with the uterine artery embolization. A lot of other conservative managements are there, but if at all multiple fibroids are there, if the symptoms are severe, the final treatment will be hysterectomy. Okay, yeah. So to conclude this session, first of all, we should identify almost 1/3 of the women who are menstruating, they might have heavy periods. So we should be very much aware about these heavy periods, and we should timely we should approach for the medical attention and the management for the cause of the HMB. Thank you.